Hello, Doctor.
Hello, Jane. Thank you for coming in to see me today. How can I help?
Hi, thanks for calling. I've been getting pain at the top of my stomach on and off for a while now. I know it's probably just heartburn, but it started interrupting my sleep. Gaviscon isn't really helping anymore, so I thought I'd better check it out.
I'm sorry to hear that. Can you tell me what's been happening?
Well, it's a sort of burning pain right in the middle at the top of my stomach. It's been bothering me for months, but over the last few nights it's really flared up and kept me awake. I've had to get up in the night to drink milk to try and settle it.
And do you find that the milk is settling the pain?
Yes, a glass of milk does help a bit, but it doesn't last long. I can't really keep drinking milk all night, though, can I? The pain just keeps coming back, especially at night.
And have you found that there's anything that's triggering the pain?
It usually comes on about half an hour after I've eaten. I tend to eat quite late after the restaurant closes. Normally just cheese on toast before bed. That's when it seems to start up, when I'm trying to get to sleep. Sometimes it's sore if I haven't eaten too, but it's definitely worse after food.
And have you tried avoiding eating late at night?
Honestly, it's just not practical for me. With the restaurant, I can't sit down for dinner earlier. By the time we close, it's the only chance I get to eat properly, so I haven't really tried changing that.
And you mentioned that you're taking Gaviscon at the moment. Have you tried any other medication?
No, just Gaviscon liquid. That's what the doctor recommended when I was pregnant with my son. It worked all right back then, but now it only helps for a little while. I haven't tried anything else.
Okay. And what would you like me to help with today?
I'd really like something to help with the pain, so I can actually sleep. And I want to know if you think it could be an ulcer. One of my customers mentioned it last night, and now I'm a bit worried. I just want to be sure it's nothing serious.
And is the pain causing any vomiting?
No, I haven't been sick at all. It's just the burning pain, really. Sometimes I get a bitter taste in my mouth, but I haven't vomited.
And have you noticed any blood in your stool?
No, never. My bowels are normal, and I've not seen any blood or anything unusual.
Okay, well, those are the red flags that I would look out for. If it were an ulcer, those were the things that we would expect to see. So I'm pretty confident it's not an ulcer.
Oh, that's a relief to hear. So what do you think it is then, if it's not an ulcer? And is there anything I can do to actually get rid of it?
I'm going to prescribe you with some stronger medication than Gaviscon, and if you could come back and see me in 2 weeks, we'll see whether that's helped reduce the pain. Does that sound okay?
Yes, that sounds good. Is this something I'll need to take forever? Or just for a bit? I
No.
don't really like the idea of being on tablets long term at my age.
If you could take it for 2 weeks, let's come back and review it after 2 weeks. Thank you for coming in to see me.
Congratulations on completing your consultation. How can I help you better understand the feedback you received?
Could you tell me how I can improve my data gathering skills?
Of course, to improve your data gathering skills, try to follow a clear structure when you take a history. For upper stomach pain or heartburn, always ask about the main symptoms, but also remember to screen for red flag symptoms that could suggest something more serious. These include unexplained weight loss, difficulty swallowing, vomiting, blood in vomit or stool, and any lumps in the abdomen. Also, make sure to ask about lifestyle factors like smoking and alcohol, as these can make symptoms worse and are important for both diagnosis and management. Before or during the consultation, check the patient's records for any previous test results or relevant history, and use that information in your discussion. Finally, Try to use open questions first, then narrow down with more specific ones. This helps you get a full picture of what's going on. Would you like some examples of questions you could ask in a case like this?
No, that's okay. Can you tell me? I did ask for some red flags, but I obviously missed some. Can you tell me what I missed?
Absolutely. You did well to ask about vomiting and blood in the stool, which are important red flags. However, there are a few more you should always check for when someone has new or worsening upper stomach pain or heartburn. These include unexplained weight loss, difficulty swallowing, which is called dysphagia, and whether the patient has noticed any lumps or masses in their abdomen. These symptoms can sometimes point to more serious conditions like cancer or severe ulcers, so it's important to ask about them every time. Would you like tips on how to remember to ask about these in future consultations?
No, that's okay. What did you think of my bedside manner with the patient?
You were friendly and polite, and you did ask the patient what she wanted help with, which is great. However, the feedback pointed out that your approach could be more person-centered. For example, when the patient was worried about having an ulcer, your response was a bit brief and didn't fully explain why you thought it wasn't an ulcer, or use her previous test results to reassure her. Also, when you suggested a new medication, you didn't really involve her in the decision or ask about her feelings, especially after she said she didn't like the idea of long-term tablets. In short, you were caring, but you could work a bit more on sharing your reasoning with the patient, involving her in decisions and exploring her concerns more deeply. Would you like some ideas on how to make your consultations more collaborative?
No, that's okay. Thank you for the feedback.
You're very welcome. If you have any more questions or want to practice another scenario, just let me know. Good luck with your studies.